name is Nancy, and I would like to talk to you today about one of the more common diseases that high school, adolescent, and college students can catch. How many of you have ever acquired the kissing disease? Do you know which disease I'm talking about? I'm talking about infectious mononucleosis. According to the Wikipedia Encyclopedia, if you haven't yet, chances are you will acquire this disease at some point in your life. It usually hits adolescents or young adults and college students. Today, I'm going to talk to you about this disease. First, let's define infectious mononucleosis. According to the clinical diagnosis and management by laboratory methods, infectious mono is a secondary disorder to an infection of the EBV virus, the Epstein-Barr virus, and it is from the herpes family. Through my knowledge as a laboratory technician and through some research, I have found several informative things that I would like to share with you today. First of all, I would like to talk about the transmission, the symptoms, the diagnosis, and testing of infectious mononucleosis. Moving on, I would like to look at how infectious mono is spread to other individuals. The transmission of infectious mono from one individual to another can occur in several ways. The most common way is via saliva. It's how it received its name, the kissing disease. This usually occurs by eating and drinking after one another or using other utensils from someone who has had the virus. It can be transmitted through blood, but is very unlikely. According to the American Medical Association Home Medical Encyclopedia, the symptoms of mono include a high temperature, sore throat, fatigue, and swollen lip glands. It is important to remember that some people who do and are exposed to the virus do not experience any of the symptoms as listed above. Still, they are able to carry and spread the virus unknowingly. Moving on to the laboratory tests that are used to confirm if a person has infectious mono or not. The testing for infectious mono is quite simple. When someone is exposed to this virus, the individual will develop a heterophil antibody. This is what it will be tested. Bakerman's ABCs of interpretive laboratory states that the monospot test is the most common test for the detection of this disease. According to the BioStar Acadia Mono 2 testing manual, the monospot test is a rapid chromatographic immunoassay for the qualitative detection of infectious mono through the heterophil antibodies in either whole blood or serum. At this point, I would like to demonstrate what the test would be. You would have your blood work drawn and it would be slowed down. You would have 1 drop of serum placed into a pipette tube. 2 drops of the buffer would be added to the serum sample. You would add a test strip, and we would wait 5 minutes for it to absorb up the test strip. And then after it has done that within 5 minutes, you will read it. And this is what a positive result would look like. The antibodies would react to the absorbent pad, and your test strip right here would have a red line if it was in color. And if it was negative at your T for your test, there would be no line. So you'd be negative for the heterophil antibodies. A CBC or a complete blood count may also be ordered by the physician to aid in the detection of this disease. If the white count is elevated with the presence of reactive lymphocytes on the peripheral smear, this is usually a very good indication that the person does indeed have infectious mononucleosis. In closing, on my topic of infectious mononucleosis, I would like to tell you about the potential treatments of infectious mono. Ah yes, the treatments, of course. Mono, well, there isn't one. According to the article in eMedicine Health, the #1 recommendation for the recovery of infectious mono is lots and lots of rest with minimal activity. This is because it allows time for your body's immune system to destroy the virus. One good thing is all patients usually recover after 4 to 6 weeks, which you don't usually have any side effects, liver disease or anything like that. It's very abnormal. And lastly, but leastly, if you don't want mono, try not to kiss others and eat or drink after others. Thank you. Any questions? No? Great. Thanks. Have a good day.